Thank you for joining us today for a discussion about an exciting career as a professional medical coder. My name is Ashley Speaker. I am the program coordinator at Corporate College, a division of Cuyahoga Community College, and I'm joined today by Margie Cataldo, our instructor for our professional medical coding classes. So Margie, thank you so much for being here today.
Thank you for having me.
Yeah, this is so exciting. Every time I get to do one of these interviews, I learn something else, and there's so much wisdom, just interesting careers that our instructors have had, and you get to share with me those little nuggets. So as we talk, I just want to ask you some questions about a career in medical coding, because I think that's something that people know about, but they don't necessarily know what that looks like day to day. So if you could just give me a little bit of your background and how you found yourself in this field.
Well, I started back when I went to work in a long-term facility way back when. I was introduced to coding from the lady who was leaving, and I was taking her position. So she was training me. And when she was training me in coding, I got hooked. I love coding.
Wow.
I do. It's not boring to me. It's very interesting. There's a lot of aspects to it. I love to talk about it all the time. So yes, it was real interesting to get started.
Wow, that's really cool, because when you think about, even just the term like professional medical coding, it doesn't necessarily sound that exciting right off the bat. So what kind of things, excited you or drew you to it?
I think what the challenges of coding, and you learn so much because you have to learn medical terminology, the anatomy. It's all involved in the medical coding. It's just not coding. There's a lot involved in it. So it's very interesting because I love the medical field, and this is about the closest I could really get to it, and it's so interesting to me. It's very interesting to me.
Ah, that's really cool. So yeah, so you get to learn all these different actually aspects besides just the code itself.
Right.
Like you mentioned, anatomy, so important when you're entering information to be able to understand what you're entering.
Correct.
What does the day-to-day then look like for someone that goes into the office every day as a professional medical coder?
Well, it begins as soon as the patient walks in. And as soon as the patient walks in, there is a billing cycle that begins. And with the billing cycle, and there's documentation that begins with the doctor documenting what they're seeing the patient for. And they kind of billing and coding run hand in hand, because with the billers, you need the codes to submit claims. So, and the coders have to actually look at the documentation to support what codes they are choosing for the billing. So it's very interesting to decipher sometimes the documentation that physicians are writing down and on patients. So it's really interesting to try to draw out more information so that we can get better diagnosis codes for them.
Sounds like you need to ask questions, or at least know the right questions to ask as you're going through the codes.
Correct, because back when we were in ICD10, ICD10 was very non-specific coding. And in 2015, when we became and got into ICD10 coding, ICD10 coding is more specified coding. We have laterality, we have even the upper portion of the body to the lower portion of the body. So the documentation has to be a little bit more exact so we can get the more specific code for them.
So during the career, especially when you're going through these changes with the coding, is there professional development that you have to continuously take to stay up to date?
Yes, there's as a professional coder, you need continuing education units. So there's always a lot of seminars that you can attend. There's a lot of magazines that you can read. The AAPC sends you a magazine every month, and you read those and you answer questions and you maintain your certification with your CEUs. There's constant changes, so you have to constantly be abreast of all of them so that you can correctly.
Yeah, I imagine it's really important to stay up to date with the way the medical field is these days.
We've been watching on some of the stuff with the COVID-19.
Mm.
So this has been very challenging. There's a lot of information out there. I've been reading about the diagnosis coding for just the COVID, how they're trying to get that a little bit more specific than just a flu symptom.
Oh, yeah, that makes sense. And definitely needed. And like you said, just staying up to date, things are changing rapidly.
Correct.
So as you enter the career field, if someone was, taking that journey, they took the class, they entered the medical coding field as a professional, where would their career kind of go? Is there like a lot of different options for them as far as like what type of office scenarios to work in? Is there room for advancement as they're moving along?
Yes, because there's so many specialties in medicine. There are also specialty certifications that a person can take. You
Okay.
can specialize in just, let's say, an anesthesia, or you can just specialize in cardiology. If you're working for a doctor that's a cardiologist, you can specialize in that coding. When you start working as a coder, it's a little bit difficult because if you have never coded before and you sit for this certification, you're an apprentice for about a year. So
Hmm.
you're a CPCA, which is an apprentice program. And so with that, you can more or less an entry level. But as you become more specialized, there's a lot of opportunities because it's always evolving. It's always changing. Every year you have a new code, a revised code, a deleted code. So with that, you have to keep abreast of all the regulations and the requirements for coding. So there's always job opportunities, and you can move on to become an auditor and audit charts instead of just coding. You can audit for a lot of different positions. I became an auditor, and I was going to different physician offices and auditing charts to see if they're coding correctly, if their staff is coding correctly. So there's a lot of opportunities other than just coding.
Wow. I love the way you talked about, all the different specific areas and then these other like outside of medical coding, but still in it where you can move up to be an auditor. So you're not necessarily doing the same thing maybe you started out in your career, but you've kind of progressed along. That is really great to know that there are so many opportunities with that. And then, so you mentioned that you did that, and now you're an instructor for us here at Tri-C. What made you go into instructing?
Well, when I took the course, I took it at Brian and Stratton, and the director there, she saw that I had passion for it. So she approached me and asked me would I like to become an instructor. So I said yes, and they sent me to Chicago. I went and passed the certification for instructor, and then I was approached by Tri-C, which I'm very honored to be part of, and I have loved it ever since. Students are amazing because they really want to learn coding. They're just amazing group of people. I've had very good pass rates with my classes, so I'm very proud of that. And I enjoy teaching it because I am getting to the age where my Social Security is going to be kicking in soon. So
I
I am
understand.
real, I would love to see everyone progress and get, and see the how how wonderful and how the great opportunities there are in medical coding.
Yeah, that's awesome. I can tell your passion when you speak and, being able to open those doors for the next, generation of individuals that'll take the reins for medical coding. That's
Yes.
really cool. So as you think back, as you were getting into the field, what surprised you the most about it? Or were there any challenges that you found as you entered this field?
Well, the challenges I found is that when I started, there was not a lot of information out there to help, with like the internet and, get some more information from other associations. And so that was a little bit of challenge. And I think the challenge that I have is getting physicians to do documentation, to get, like I said, the higher specific code. When I-10 first came out, there was a lot of backlash on it. A lot of doctors
Hmm.
didn't like it. And so there was a lot of resistance to it at first. But I find that the only challenge I had was, there was not a lot of information when I started, but luckily now with the internet and there's a lot of magazines, the students are very lucky everyone who entering this field, very lucky to have as much information afforded to them.
Do you have any advice for someone who's looking to get into it? Obviously we'd love to have conversations with them at the college, but, if they were thinking about, do I have the skill set for it? What makes a good medical coder? Do you have any advice for that individual asking those questions?
Yes, it takes patience to become a coder because you have to actually do some researching. And so it's almost like becoming a sleuth. You have to actually research the diagnosis, you have to research what you're looking for, and numbers. And if people aren't into numbers, they might not, like it. But I find it so interesting that when I see other people talk about coding, it just lights me up because, like I said, there is, as long as there are sick people, and there will always be job opportunities for coders. And because, like I said, since it's always changing, there will never be someone without a job. So coding is a wonderful field to get into. You can work from home if you have children and you can't really go out, like a lot of us are doing now with the COVID. So there's opportunities for single moms to work from home because a lot of the hospitals are working from home. I have a student that she now works for a company in Cleveland but lives in Texas and does coding. So it's wonderful that you can move anywhere, and this certification is a national, it's throughout the United States, so you can go anywhere in the United States and do this kind of job.
That's fantastic. Like, just knowing that there's opportunities, even with our current situation, being able to work from home, having that flexible schedule if you have kids. And I love that you talked about being a sleuth. I mean, that kind of changes the perspective. Also, you're asking questions, you're trying to figure something out and trying to get the correct information, right? That at the end of the day. Very cool.
Yeah, it is very cool because you're not, you're using so many different books and information. You're using an ICD for diagnosis, you're using a CPT for procedure, you're using a HCPCS for equipment. So there's a lot of different aspects of coding, and there are positions for just HCPCS coders, for like orthopedics. So people can get into that kind of field. And orthopedics is a big section of medicine, so that they can go there and work from just doing that. I've had students that are very successful in just coding for like orthopedics.
Oh, wow. Now, when you go into a more specialized area, would you need to take additional classes or get an additional certification in those areas?
You can. It would be beneficial to the person if they can get a specialized certification. You have to become a certified coder first. Then after, you can sit for other certifications. I have different certifications. I'm also a billing specialist, a reimbursement specialist. I have the healthcare management degree. So there's a lot of different things that you can get into. And some people like to just do the billing, and some people like to do the coding. And so there's certifications for billing also. So there's wonderful opportunities.
Thank you so much for talking to us today about all these wonderful opportunities. I know I was definitely enlightened to learn more about the medical coding profession. So thank you so much, Margie.
You're welcome. Thank you.
So if you're interested in more information about a career in medical coding profession, please visit the link in the text above. And my name's Ashley Speaker from Corporate College at Tri-C. Thank you for joining us.